The following is a summary of the ACLS survey for respiratory arrest. So in respiratory arrest, what are you going to assess? Of course, you're going to assess airway. So what are the questions that you're supposed to be asking? Is the airway patent? So how are you going to maintain airway patency in an unconscious patient? Of course, you need this maneuver. What do you call this maneuver? The head tilt chin lift maneuver. What else? In order for you to maintain airway patency, especially if there's if the patient's tongue is blocking its airway, you have to use what? OPA. What is that? Oropharyngeal airway. Or what else? If the patient is conscious, what are you going to use? You're going to use the nasopharyngeal airway. Another question, is an advanced airway indicated? So the question here is, when is an advanced airway indicated? And what are advanced airway? Okay, advanced airway like laryngeal mask airway or the LMA, laryngeal tube or the esophageal tracheal tube or the endotracheal tube. So the benefit of advanced airway placement is weighed against the adverse effects of interrupting chest compressions. If bag mask ventilation is adequate, healthcare providers may defer insertion of an advanced airway until the patient fails to respond to initial CPR. So, advanced airway is indicated when the patient fails to respond to initial CPR and defibrillation. And when does advanced airway not indicated? Advanced airway is not indicated when there is already a spontaneous circulation returns or the return of the spontaneous circulation. Then advanced airway is not indicated anymore. But an advanced airway such as laryngeal mask airway, laryngeal tube, or esophageal tracheal tube can be placed while chest compression continues. So are you going to stop chest compression when advanced airway is being inserted? The answer is no. You have to continue chest compression. So when will be the only time that you're going to stop chest compression? If there is no advanced airway and you're doing the 30:2 ratio, 1 rescuer or 2 rescuer adult or child victim. So what else are you going to assess in your airway? Let's say you already have an advanced airway. The next question is proper placement of airway device confirmed? So you confirm proper placement of advanced airway devices by what? Physical examination. What else? The quantitative waveform capnography. This one is the class 1 recommendation for ET tube. And what is the normal for quantitative waveform capnography? Normal here for a normal person is 35 to 40, but if you're measuring this on your cardiac arrest patient, when you're doing compression, you're doing a good compression if you're getting 20 millimeter per mercury. And what else? This is also reasonable for supraglottic airways. And what else are you going to confirm when you're using advanced airway devices? Make sure to confirm proper integration of CPR and ventilation. What is the proper integration of CPR and ventilation if you have an advanced airway? CPR is continuous, ventilation is continuous. And what is the rate of ventilation if you have an advanced airway? It is 6 to 8 seconds per 1 ventilation, per 1 breath, or 8 to 10 breaths per what? Minute. And then another question for airway, is the tube secured and placement confirmed frequently? So you have to secure the device to prevent dislodgement, and you have to monitor airway placement with continuous quantitative waveform capnography.